It is January 23rd. It's actually the day after what should have been surgery, but it got canceled yesterday morning. An hour before I was gonna leave for the hospital, um, basically, they didn't have what they needed for surgery. They didn't have the tissue expanders, and I think there was just a delay in that. And it was unexpected and all that. So it's no big deal. It's just, it changes plans for everyone. And so it's a bit of a hassle to an extent for everyone involved. But the new date is February 1st at 7 a.m. Wait for it. The arrival time is 5 a.m. The things that I'm used to. It's great. We're going back to the good old first surgery of the day situation. So oh my gosh. I think I got all my nerves out thinking that yesterday was surgery. So I'm over here just kind of relaxing, enjoying another week without surgery, but also wishing that it could have been done by now. There's mixed feelings, but I'm less nervous right now. I think it's gonna kick in next week, and it's all gonna come back. But for now, I'm okay. I'm good. Okay, try this again. It's day before the 21st surgery. Again. This is the rescheduled day, so February 1st is tomorrow, and that's the day. 7 a.m. surgery, 5 a.m. arrival. I'm not excited about that. I'm excited to get it done. I'm excited to be early enough to where I won't be as nauseous without food for as long as I have to wait. But I am glad that I'm staying overnight. I'm glad that I'm going to be observed. It's not supposed to be a long surgery, which is good and makes me kind of be more at ease because I'm under for less time. I should be used to anesthesia by now, 21 surgeries later, but there's something about just like all this hardcore medicine that has to go in my body constantly, like every few months kind of. It's rough because I'm young and I don't want all this going through my liver. I don't want it going through my lungs and heart and whatever else it touches. I am not a medical professional, so I don't know what all it affects, but I know that narcotics and other medicines can affect your liver long term if used too much. But that's why I do my best to maintain my pain, but also not overdo it on the pain pills. So yeah, I am nervous, but I feel like I don't know. I just feel like my nerves are still there from last week when I thought I was having surgery, and I haven't been sleeping well. But I think after tomorrow, and once it's finally over, when I wake up, I'll feel better. If you've seen my other videos, it's not shocking that I'm still awake the night before a 7 a.m. surgery. It's just very typical for me. It's fine. But anyway, so my cutoff for food and drinks was 11 p.m. Okay, so I wanted to be awake for that long because I want to be as minimally... Wait. I want to not be nauseous if I can help it tomorrow. even though I typically end with anesthesia because I wouldn't have eaten in like 10 hours at that point or longer. So it's not an easy process, but I typically either stay up late or go to bed at the latest I can after the food limit. So that's why I'm awake. Oh my gosh, that I need to go to bed. I just showered, so my ears are off, but they're clean now. My ears are clean. That feels weird to say, but yeah, I have to put them on so that I can wear my glasses and then finish up things and then go to bed. But that's why I put them on, because you're probably thinking, why would you put them on if you're just going to take them off for sleep? Well, that's because I have to see. So, yep. Great. Good night. On our way. It's bright and early. We made it.
Yay!
It's 4:50 a.m.
Oh boy.
Oh, yay! It's February 3rd. So 2 days after 21st surgery and a day after my 22nd surgery. Surprise! 21st was what I expected to come here for, which was inserting the 2 tissue expanders on the left side of my face. And I think it's coming off. And then, so they didn't do a drain initially because they were like, this is a foreign object, so that could be a chance of infection. So they were back and forth about getting the drain in initially, and then the next day, so yesterday, I noticed and they noticed that there was swelling on my neck where there was fluid, and so it was painful for me, and I noticed the swelling. It didn't look great, and they were at the point of a little bit of concern where they have to get something done about it. So they decided to take me back to the OR in a sterile environment, put me under. So technically it was a very quick surgery, that it was another surgery because they had to do what they did. And I just, a back-to-back 2 surgeries in 2 days has worn me out, and I'm getting over the pain of the first surgery, but the second surgery caused a little bit more soreness, and I just have to kind of push through and make sure I'm maintaining meds and tolerating everything, and so that's where we're at now. But it's just been a wild ride right now. Now I'm probably not going to be able to go home till Monday, and that would be just taking out the drain. I might have other needs to stay a little bit longer. Not sure yet, that I'll update you more on that. But it's just been a process, and I'm happy. I love the hospital. I love the staff. I love the doctors. They're very dedicated to their patients, and I made it a point to vocalize how much I appreciate them and how well they do their jobs, because I really don't think people show enough appreciation. And yeah, typically people as patients, it's hard to be happy and have good spirits, but I do my best to be a good patient, to not, be so needy if not necessary. And because of that, they even tell me, well, we appreciate that you appreciate us. I want people, like doctors and nurses, to know that they are so appreciated. Like they have helped me save my life and get me back to where I want to be as much as I can be, given the circumstances. And it's not easy to vocalize that when you're not a positive person. And, maybe a year ago, I wouldn't be so positive with them because I'm just tired of it. I'm tired of dealing with everything I'm dealing with. But you know what? That's not their fault. They didn't do this to me. They're helping me. They're trying to help me. All they do is try to help people. And if they're nice, then the patient should be nice. I just feel like if ever you're a patient for really anyone, like primary care or hospital or whatever, just show them and tell them that you appreciate them, because it'll make their day. So anyway, that's just my thoughts of the day and the past couple of days, knowing that people are just so nice to me and so helpful. Well, it is day after the 22nd surgery at this point, February 4th, and still in some pain. The drain is working well. It went from like 40 milliliters of fluid to 25 another day to now 10. So I'm going home today. It only took me 6 days to get home, but look at this view. Pretty great. Dallas. Lots of cars, lots of buildings. Okay, anyway, I'm going home. Everything looks good. It looks kind of weird, but that's the tissue expander. It looks great, according to my doctors. So, I'm very excited. I can't wait to go home. My dogs are gonna be so excited. They have no idea what's coming for them. And I am just so glad that, of course, not knowing that I was going to have 2 surgeries in 2 days, that they both went well. The drain is out. The drain has been out for 3 hours at this point. Now I signed the paperwork to get discharged, and I'm getting out of here. I'm so excited. Finally heading home to the dogs and my own bed and home-cooked meals. Tired of